Local kids catching COVID are getting sicker than before. That's the message from an infectious disease specialist at Seattle Children's Hospital, as parents are preparing to send their kids back to school, and many of those parents are worried about COVID. So let's show you some of the numbers. Kids ages 0 to 19 here in this state make up more than 18% of all cases in the state, and more than 2% of hospitalizations in the state involve kids. At Seattle Children's, doctors are now saying roughly the same number of kids in the intensive care unit as they saw during last winter's spike. But the kids they're treating are much sicker than before, with more severe symptoms.
We're seeing teenagers who are otherwise healthy, except for maybe asthma or obesity, and they can be quite ill, and that's what's feeling different this time around.
Dr. Zare says when looking at the sickest patients, the vast majority are old enough to be vaccinated but are not. She says the #1 step that parents can take is getting your teenagers vaccinated. The problem for many parents, kids under the age of 12 still are not eligible to get the vaccine. And today, the director of the National Institutes of Health said he doesn't see emergency approval for kids under age 12 happening until late this year. So parents are shopping for back to school right now. There is a must-have item on your list, and that is masks. Recommendations say kids 2 years and older should be masked when they're indoors. And remember, schools are going to require them. So how can you get your younger kids ready to wear a mask all day?
Sometimes I'd like to give kids a choice. You know, we're going to the store today. Which of these 2 masks do you want to wear? Kids love that. They want to have some autonomy. Find something that's comfortable so that it's not pulling too hard on your ears. And preferably something that has adjustable ear loops, right? That works best.
And with that said, all masks, we know they are not created equal. Okay, good. Those are any surgical or cloth mask. Better getting your kids to double mask, especially if that helps get them with a really tight fit. The best, though, those are the N95 or KN95 masks. The genuine ones are made to fit kids. They filter out more particles in the air, and they're designed to seal against your face. But pediatricians say really the best mask is the one that your kids will actually wear.